Cute animals are amazing. They're one of the few things that's getting us through hard times. But in the grand scheme of things, millions of them unfortunately need to die for science. Let me explain. Animal testing has been a part of almost every medical breakthrough in the last century, and it's still needed today for applications of biomedical research to reach us, the consumers. Here at Kelvin, under DeVries Hall, is the West Michigan Regional Laboratory, an independent research facility that I've visited several times, which houses various animal species, such as sheep and pigs, where they await surgeries and studies while in comfortable holding areas. Animal research is all around us. It's necessary, does not violate animal rights, and is needed to save countless lives. So why is it necessary? According to Stanford University Medicine, animals are biologically similar to us, might share 98% of the DNA with us, so that means they're susceptible to most of the same diseases. We can also study them from development all the way to death with their short lifespans, and even generation to generation. We can also control their environment, so then if they get better, you know it's from your new drug and not from a raise in temperature in their cell. So that's why animals make such a good model, but what animals are used? According to the Office of Technology Assessment, it is estimated that between 17 and 23 million different animals are used in research every year. Approximately 95% of those are mice and rats, genetically engineered for research, and the other 5% is anything from rabbits to guinea pigs, sheep, fish, frogs, and importantly, less than 1% are cats, dogs, and primates, as they are the closest to humans that we can get. Now, what are the alternatives? The main two are computer modeling and using single cells in test tubes. Both come close to animals, but are nowhere near as good at the moment. However, it's important to note that according to the American Medical Association, humans are the most used animal in research. However, almost all of this research is in later stages. All preliminary studies must be done with animals so that you can determine the side effects and so that it's ethical to use with humans because they can't consent to something that they don't know what it is. So how is animal testing done right? Number one, laws. Lots and lots of laws. At the institutional level, federal level, you need certifications, and there's oversight bodies over everything. Researchers requesting the use of animal models must gain approval from a committee with a fellow researcher, veterinarian, and community member to say whether this is benefiting the public health. Now, all animal research must follow the 3 R's of replacement, reduction, and refinement. Replacement says that when possible, don't use an animal. If you can use computer modeling or cells in a test tube, great, use it. And reduction says use the lowest number of animals that you possibly can. If you use too few, you won't get a scientifically sound result. And if you use too many, then you're wasting precious animal life. Refinement says that for every action, see if there's one with less pain. So if you're doing a surgery, this might mean anesthetic or a smaller needle if you're inserting a drug. Now, it's important to note that if animals are not well treated, the science and knowledge they produce cannot be trusted. It just can't be replicated because the animals are not in their natural states. Now, animals are not always great models. They're not humans, and they don't always give us the same results. But they're the best we have. Unfortunately, animals can't consent. So some animal rights groups have argued that this violates rights, but it's true, we can't have them sign a waiver before doing any of this. And admittedly, some tests, especially of the past, were unnecessarily cruel. The Days test and LD50 in particular had lots of animal suffering and death that was not necessary. So we should move away from animal studies as soon as we can, but we can't just yet because they're doing so much good. According to the National Research Conduct Council and Institute of Medical Committee, in the United States, animal experimentation has contributed to an increase in average life expectancy of 25 years in the last century. That is insane, and it's contributed to advances in everything from cancer and vaccines to antibiotics and organ transplants, all made possible with animal testing to make sure it was safe for human use. Additionally, more than 80 different medicines and vaccines originally developed for humans are now used to treat animals as well. This helps both us and them. Nothing so far has been discovered that can substitute for a living, breathing animal with all their organs similar to a human. Until we discover such an alternative, animals must continue to be used as they play a critical role in testing new drugs and treatments for effectiveness, safety, and side effects. There is a very real movement by animal rights groups to abolish all animal research. It is of the utmost importance that we advocate for science, ethical practices, and good data in not just animal testing, but across the board in climate change and disease. In order to prevent harm for everyone, the general public must be educated in scientific literacy, and we must be willing to sacrifice a few animals for the betterment of us and them, or countless lives will be lost. Thank you.